In this video, we will learn about Private Provider HF Incentive Scheme. Let us understand about the Private Provider HF Incentive Scheme. This scheme is aimed at providing incentives to private providers and informants. Under this scheme, the beneficiaries are different private providers. Incentive of Rs 500 will be provided for notification to private providers, which can be qualified practitioner, hospital or clinic, laboratory, pharmacist. Incentive of Rs 500 will be provided for the treatment outcome update to the qualified practitioner, hospital or clinic. Rs 500 is provided to informant, can be any person, for referral of a presumptive TB case to a public sector health facility and on positive test result. Presently, NICSHE enables users to pay only the private health facilities for notification of TB patients and also for referring cases, that is, informing to public sector laboratories for diagnosis. The ability to pay other informants for referral for diagnosis and to TB patients for self-notification will be added subsequently within the same scheme. For the time being, these need to be paid manually by PFMS. There are 6 steps to be followed for processing payments in NICSHE under this scheme. The first step is registration of private provider. For being able to notify TB patients, the private providers must be registered in NICSHE. The second step is update bank details of private provider on NICSHE portal. Private provider has to provide the bank details as the program or government will pay the incentives directly into the bank accounts of the private provider. The user bank account must be a saving bank account as NICSHE PFMS rejects all other account types. Hence, user need to provide saving bank account only. The third step is approval of bank details by DBT checker. After the bank details are saved by the private provider, it is approved by the DTO. All these 3 steps, registration, update of bank details of private providers and approval of bank details by DBT checker is a one-time activity. The fourth step is auto-generation of benefits. Based on the eligibility criteria, NICSHE automatically generates the benefits. The fifth step is approval of benefit by DBT maker. Here, the DBT maker at TU level has to approve the benefit before it is released. The last step is approval of benefit by DBT checker. Once the benefit is approved by the DBT maker, it gets to DBT checker login where it is approved by the DTO. As these benefits are accepted in PFMS, they have to be approved in PFMS via DA login. This completes the process of understanding the Private Provider HF Incentive Scheme.